you for joining today's conference call with Governor Andrew Cuomo. I will now turn it over to Governor Cuomo.
Good morning, guys. Happy Sunday. Today's day 225. I'm joined by Melissa DeRosa, Robert Mejica, Commissioner Zucker, Beth Garvey, and Gareth Rhodes. And let me give you the numbers for yesterday. We did 118,000 tests. Let me just repeat myself for context here. We're dealing with a very specific situation, which is the clusters. The state itself is doing very well. Overall, the state is doing very well. We have such a sophisticated testing mechanism where we take now more tests per day than most states take per week. That allows us to do a very granular analysis. Most states don't have that capacity or don't have that desire. If you look at the statewide numbers, which is what most states present, we are doing very well. Statewide numbers today, without the hot spots in them, 0.84. That's extraordinarily well. That's doing extraordinarily well. We haven't been that low since September 24th. If you add in the hot spots, which is then a skewed sample, it's 0.96. 0.96 is the lowest it's been since September 24th, and that is very good. That's normally where the state's efforts stops. State would announce a statewide average. They would say 0.96. Because we test as much as we do, and because we have such an ability to target, we then see clusters, and we can track cases in very small clusters. We're now tracking a cluster in about 2 or 3% of the population. No other state has this discussion because no other state has the ability to target that way. We do, and that's a good thing, because when you can target a specific cluster, it means you can attack a specific cluster. Attacking a cluster is much easier than trying to attack a statewide increasing rate. A rifle is more targeted than a shotgun, right? Other states see the statewide number increase, and then they have to do statewide closings because they can't target the clusters. So the cluster analysis, which you don't hear about in any other state, is because we have the sophistication to do it. The testing in the clusters is 5.7, which is not good. Now, even to put the 5.7 in a focus, the positivity rate of 5.7 in our clusters is lower than many states' overall positivity number. So the number in our clusters is much less than most states' positivity, okay? So the context here is very important. and I think it's important for people to understand. The clusters are generating the new cases proportionately, because that's what clusters do. They are generating the new cases. The clusters are in the same areas that we've been talking about. 5 New Yorkers passed away from COVID yesterday. They're in our thoughts and prayers. 820 New Yorkers were hospitalized. That's down 6 from the prior day. These numbers are all weekend numbers. As I've cautioned you before, take them all with a grain of salt because they're weekend numbers. 186 were in ICU, 84 were intubated. By region, New York City, 1.1. That's what's obviously driving the number up. That's not good. Capital Region 0.6 is good. Central New York 0.9. Finger Lakes 0.9. Long Island 1. Mid-Hudson 1.1. That's Rockland Orange. Mohawk Valley 0.2. North Country 0.2. Southern Tier 0.9. Western New York 1.4. We've had an ongoing issue with Western New York, and it is not getting dramatically better. It's not getting dramatically worse, but it's not getting dramatically better either. Hotspot counties, Orange 2.5, Rockland 2.1, Broome 3.4, Brooklyn 1.5. That is where we are. What do you do about clusters? You do enforcement. You do aggressive enforcement. That's what you do. Well, what does aggressive enforcement mean? When we did the bars and restaurants, and we identified them as problem areas that were generating clusters, we put together an SLA, State Police Task Force. We've done almost 100,000 establishment visits. 100,000 bars and restaurants. We've taken about 1,500 enforcement actions on those 100,000 visits. That's enforcement. 100,000 visits is hard to do. I know. It's also called the job of government. It's the job of a regulator. You pass a law, you don't enforce the law is useless. It accomplishes nothing. It actually accomplishes a negative. The negative is people see that a law isn't enforced. They dismiss the law. The other negative is government issues another law, but government can't enforce it or doesn't enforce it. Incompetent government, ineffective government, waste of time government. Why do we pay these people? Government. Government isn't the solution. Government is part of the problem. Government is impotent. Let's all join together and be anti-government, because the government is useless. 100,000 visits, 1,500 enforcement. When I say I'm looking for enforcement from the local governments, that's how I define enforcement. The hotspot clusters, as you know, are primarily in the Hasidic community, but they are in those geographic areas, and anyone in those geographic areas is obviously more likely to come in contact with the virus, and that's the geographical significance of the hotspot areas. Hotspot areas are not done by any arbitrary means. They're not census tracts. They're not zip codes. They are literally from the cases. If you look at where the cases are, you put the points on a map. That's the geographic area. To the Hasidic community, I've spoken to the leaders of the Hasidic community many times. I have long-standing relations with them. I understand the desire to hold large religious ceremonies. I understand that. I understand how important it is to their culture and to their religion. I also understand that it, as a matter of fact, jeopardizes human life. This is not academic. The number of hospitalizations are coming from those communities. We know what happens. People get the virus, people get sick, people go into the hospital, people die. That is the trajectory. Not as many people die as died originally. We now have more information about the virus. The doctors are in a better position to treat the virus. There are different therapeutics. There are different experimental drugs. The president took Regeneron. Eli Lilly has a drug. Remdesivir is shown to work. Hydroxychloroquine was shown not to work. But people die. I say to my friends in the Hasidic community, the Hebrew faith teaches us Pekuach Nefesh, which means save a life. And under the Hebrew teachings, a religious participation in a religious ceremony can be excused for a matter of health and life and safety. Leviticus, love your neighbor as yourself. The point here is to save a life and not to endanger others, not to endanger others in the same congregation, not to endanger others in the same community. And that's what is happening with these large congregations. It's an unfortunate situation. I wish it didn't happen, but it is the reality. I wish none of this happened. I wish COVID didn't happen. But that is the reality, and you deal with reality, especially when it's about life and death. Operator, let's take a few questions.
As a reminder, to ask a question, you will need to press star 1 on your telephone. To withdraw your question, press the pound key. Please stand by while we compile the Q&A roster. Our first question is from the line of Sean Charikian from New York Daily News. Your line is now open.
Yeah, thank you for taking my call, Governor. Just wanted to clarify your remarks. I mean, it's been a recurring theme about criticism of local government. Can you just specify our incompetent government, ineffective government, waste of time government, your assessment of New York City's handling of the COVID clusters? On unrelated notes, the Mother Cabrini statue unveiling tomorrow. Will you be there in person? Have you invited Mayor de Blasio to join? Thank you.
The comment about I have been frustrated by the lack of enforcement by many local governments. Many local governments have done a very good job. You know, we have 62 counties in this state. Some have done an extraordinarily good job. Some have done a poor job. I've given you the facts on what I consider enforcement. You can apply those facts to a local situation and tell me what you think the facts show. I'm going to be at the Mother Cabrini unveiling tomorrow. I don't know who was invited and who wasn't invited, but I will be there.
We have our next question from the line of Lauren Maloney from WNBC. Your line is now open.
Hi, Governor. It's actually Howard Price here, and thank you very much for taking the call. Governor, there's been some reporting in recent days from Gothamist about a service that took place on Friday in an Orthodox shul in Borough Park. Reportedly 300 people in attendance, and reportedly the rabbi who was the officiant at the service had tested COVID positive some days previous. Are you aware of this incident, and was there an enforcement action? And do you have any details on the total number of enforcement actions specifically linked to the cluster action initiative in the hot zone areas?
Okay. First, just to take a quick half step back, if you don't mind. I don't know on the Cabrini ceremony. I don't know who specifically was invited. I know the ceremony is going to be at Battery Park City. That's where the site is for the statue. Obviously, the Battery Park City officials are invited. New York City officials are invited. Our only consideration is the size of the crowd. There's a Cabrini commission that worked on the statue itself. But the mayor, the speaker, city council, the city council head, the speaker are always invited. Again, within the parameters, they are invited. The whole audience, the whole gathering will be socially distanced and appropriate. I don't have the numbers for the cluster action initiative yet. It's ongoing. The SLA numbers, that's been going on for a couple of weeks, so we have the numbers on that. I'm not familiar with the piece in the Gothamist, but it doesn't surprise me. The several religious communities have said they don't want to comply with the rules. I understand it. That's what I say is an unfortunate situation. But if you put, here's a fact, if you put 300 people in an enclosed setting with a rabbi who tested positive, who is positive for COVID, assume those facts. I don't know if they're facts, but assume those facts. The likelihood is the virus will spread. There is no disagreement on the facts. This is a real cluster. The infection rate is much higher in this cluster. The people going into the hospitals are much higher proportionately from these clusters. And the deaths will be higher proportionately from these clusters. People will get sick and people will die from this behavior. The first hotspot cluster in the United States of America we had, because we had the first of everything, right? Remember, we were ambushed by this virus by the negligence of the federal government. China virus. They did the China ban January 29th. They didn't do the European ban until March 16th. And it never dawned on them that the virus wasn't just going to hang out in China. The virus was going to infect someone who was going to get on a plane, and they went to Europe. And it came here for months undetected. That's federal negligence. But those are all facts. The first hotspot cluster, New Rochelle, one person who was infected, went to a synagogue service, infected dozens, went to a wedding, and infected dozens. So we know the facts. We've lived here. We've done that. And so if those are the facts, I don't know the Gothamist piece, but if those are the facts, that's what's going to happen. Now, I also understand that the people of this country get mixed messages. They have a president who has denied this virus from the beginning. It's a hoax. It doesn't exist. It'll be gone by Easter. It's going to go away as if by a miracle. And he's still doing it. I got COVID. It's no problem. Just get in the helicopter, go to Walter Reed, have multiple million-dollar doctors treat you, get experimental drugs, and then you're fine. Yeah, this is all denial. This is not truth. This is distortion. This is a political manipulation of a public health crisis. Most recently, CDC gets overruled on wearing masks on public transportation. How do you overrule a health department that operates on science that is recommending to the American people to wear a mask on public transportation? How do you politically manipulate that? I mean, it is incredible how they have time and time again not only denied, but manipulated the information to the American people. So I get the mixed messages, but facts are facts. Look at the numbers. Look at the infection rate, look at the hospitalization rate, look at the death rate. We want to have religious ceremonies. I understand. Do you want people to die? Is my question. Next question, operator.
We have our next question from the line of Jonathan Epstein from Buffalo News. Your line is now open.
Thank you very much. Governor, do you have any more insight as to what's driving the Western New York numbers? Are there any actions that you think need to be taken in this area?
Nothing. I'll ask Gareth or Melissa if they have anything specific. We have not identified specific clusters in that area, which is actually bad news. You know, what you guys keep missing, gratuitous comment, finding a cluster is a good thing. Having the data to find clusters is a good thing. When the doctor can find the source of infection on the human body and can circumscribe the area and treat the area, that's a good thing. A bad thing is when the doctor says, I can't find out what's causing the infection. We don't have specific clusters in Western New York. It's a general lack of compliance which is causing the issue. And that's why our efforts have been generally to urge greater compliance, because we don't see any specific causes. Unless there's something new. Melissa, Gareth, do you have anything else?
Yeah, Governor, I'll just briefly, we're really tracking, there's been a little bit of an uptick in some of the southern western tier counties, the ones that are along the Pennsylvania border, Allegheny, Colorado, for example. And the governor announced on Friday the deployment of more than 400,000 rapid tests out to local governments. So we'll be really directing that into counties in these areas where we are seeing the uptick to help do broad-based community testing. This is a model that has worked very well in another parts of the state. Worked well in Erie County. It worked well in at Simeoniata around that cluster. So we'll be doing that. The same kind of making sure that all residents of these counties can access rapid testing, which has shown a very effective way to help control these outbreak situations.
Melissa, while there's a pause here, an operator will take one more question. But am I right on the invitations for Cabrini? The Cabrini Commission is invited. Battery Park City is invited. City officials are invited. And it's all going to be socially distanced.
It is definitely going to be socially distanced and compliant with the general rules. And I know the Cabrini Commission is invited, and I know they're going to be reaching out to other folks today. So, yes, I believe that's correct, Governor.
Is it weather permitting tomorrow, or does it happen rain or shine?
I think if it's raining, we're not going to make everyone stand in the rain, but that is the hope.
How about me? Do I have to stand in the rain if it's raining?
You always have to stand in the rain no matter what.
Yeah, it's the joy of being governor. Let's take one more.
Next question is from the line of Steve Burns from WCBS 880. Your line is now open.
Thanks, and hope you're having a good morning, Governor, and everyone on the call. I wanted to circle back on an issue from early this past week that I'm not sure ever got resolved. When, Governor, you said you were looking to have several hundred NYPD officers join the state enforcement efforts, and Mayor de Blasio was asked if that's going to happen, and he basically said, no, the governor's not going to be deputizing anyone in the NYPD to do his work. So wanted to see if there's any kind of movement on that, and secondly, I know the mayor spelled out some kind of benchmarks he's looking for to get to an end to some of these restrictions. I wanted to see if the state is mirroring those end benchmarks and if that would apply to, the outside red zone areas too in Orange and Rockland counties.
Yeah, let's do this one more time. Talk about in terms of context. The mayor has no legal authority to impose restrictions or reduce restrictions. No county executive has legal authority. But any county executive can propose, any mayor can propose, any mayor can suggest, but they are all proposals or suggestions to the state. You guys being gender neutral, have to separate so you don't confuse people. Today the county executive proposed these as guidelines, but implicit in that is propose these to the state because only the state can impose or change guidelines, right? Otherwise, you confuse people. County executive, mayor, village trustee said parks will reopen in August. That's my proposal. No, that doesn't mean parks will reopen. It means you're proposing that, but only the state can enact that. Otherwise, you confuse people because people think when the local official proposes something, it has the force of law. It often does. Not here, not during COVID, not on a public health emergency where all the legal authority is the state. Okay? Well, why do local officials propose it if they don't have the legal authority? I don't know. Why don't you ask them? The mayor said he will do enforcement. That's what the mayor said. I have said if a local government does not do enforcement, the state is legally responsible for the enforcement. And the state can legally take over local enforcement. Okay? So the state could legally take over local enforcement. We have not taken over local enforcement in any jurisdiction because that becomes a broader policy than just a public health policy, right? The mayor said he would assign 400 city employees to do enforcement. They don't have to be NYPD. As a matter of fact, our SLA, State Police Task Force, is predominantly agency personnel. These are public health orders. They're executed by health officials or by other governmental investigators, inspectors. So, for example, on our SLA task force, we have Department of Health people. We actually have Department of Environmental, we have environmental inspectors. We have Department of State inspectors. It's just a question of an inspection function. It doesn't have to be a police function. So he said he would assign 400 city employees to do the enforcement. Not NYPD. That's an important distinction. They would never have been, I don't deputize, I don't take over. They're still city employees, right? So we have statewide county employees working with us right now. Rockland, Orange, Nassau, Erie County, Broome County. We have local officials working for us. They are still local employees. We don't pay them. They don't become state employees. They are still local employees. But we are in charge of the enforcement to make sure the enforcement actually happens. So even on our SLA task force, we have county people who work with us on those task forces. And in this situation, the mayor said he would identify 400 people who would work with our task force on doing the enforcement. Melissa, anyone else? Is there any update on that? Did I state that correctly?
No, you said that correctly, Governor.
Okay. Thank you all very much for taking the time. On the point about the Gothamist, if that is true, then I would hope the action is taken. You cannot allow a law to be violated, otherwise nobody will follow it, and more importantly, people will get sick, and people will go into hospitals, and people will endanger nurses and doctors who now have to deal with COVID. People will infect other people who are just innocent bystanders, and people will die. This is not a joke. New York's success is because of New York's effectiveness and intelligence and discipline. That's all the difference. Incompetence causes death in this situation. I can't be any more clear. Thank you, guys.
Ladies and gentlemen, this concludes today's conference call. Thank you all for participating. You may now disconnect.